So the goal of the UPMC Advanced Head and Neck Surgical Oncology and Microvascular Fellowship is to train the next generation of head and neck surgical oncologists who are comprehensively trained in all aspects of the clinical and research management of patients who suffer from head and neck cancer. We seek to offer a comprehensive program that covers the entire gamut of knowledge base for fellows seeking to enter the field of head and neck surgical oncology. We provide our fellows with instruction and education in aspects of ablative surgery, robotic surgery, microvascular reconstruction, translational research, and most importantly, we offer them experience and exposure to the fields of medical oncology and radiation oncology.
This is a very busy clinical fellowship. You are going to get to participate and get your hands dirty in the entire depth and breadth of head and neck surgical oncology, from transoral robotic surgery to complex ablative surgery to microvascular reconstructive surgery. This is what defines Pittsburgh and really sets us apart as a high volume, high acuity head and neck cancer center.
We have a very high volume microvascular program here doing upwards of 150 to 170 microvascular cases. We obviously do a lot of the bread and butter microvascular cases, including anterolateral thigh flaps, radioforum flaps, and fibular-free flaps. But we also have an innovative and creative practice in that we also will incorporate subscapular system flaps, medial sural artery perforator flaps, and various other perforator flaps, just depending on the clinical scenario.
We see a variety of patients with many different pathology of various stages, and so the fellows become very well versed and trained in taking care of patients with the need for many different types of ablative surgeries.
Reconstructive surgery is a major component of the fellowship, and it has been for several years now. I was the first otolaryngologist to do free flap reconstruction within the department, and since that time we have grown in leaps and bounds. At this point, the reconstructive service is very, very busy. We focus the fellows at the beginning of the year on really getting one-on-one attention with the attendings and learning all the steps to all of the reconstructive surgeries and flaps. And then slowly we graduate them to more autonomy and to being junior attendings in the department.
One of the things that attracted me to this program is that the focus isn't just on reconstruction. You are focused on both the complex ablation and the reconstruction. In many programs, you're just doing free flaps every day, and although that is important, less of the focus is on the cancer aspect. And in this program, you get to focus on both, and you can develop your ablation skills just as much as your reconstruction skills.
We have had a long track record of excellence and high volume clinical training, but investigation and pushing the boundaries and moving the field has also been something that we are known for, and that is through our research opportunities. Those can be in the laboratory, wet lab, those can be bioinformatic and analyzing big data. And so there are tremendous opportunities for clinical research, analyzing large populations of patients with particular subsets of head and neck cancer, those who have undergone robotic surgery, for instance, or salivary gland cancer, or treated with immunotherapy in the adjuvant or in the preoperative neoadjuvant setting. A number of us have active NIH-funded research laboratories, and so the fellowship is highly integrated into the NCI-designated Comprehensive Cancer Center, providing tremendous research opportunities in genomics, immunotherapy, and all kinds of applied science that impact on patient care.
Now, of course, during a busy clinical fellowship year, the opportunities to conduct translational research or participate in prospective trials may be limited, but importantly, you make the connections with the people who are doing that work. And it allows you to develop mentors, lifelong mentors, who are leaders in their respective areas of head and neck cancer research.
One of the really important things about medicine is that it's constantly evolving and constantly changing. And so innovative practices are critical to the training of the next generation of surgeons. We want to stay not just on the curve, but we want to be setting the curve at UPMC.
One of the benefits of such a large system is that we have a lot of resources for our education, for our growth, and the opportunity to also teach residents. For instance, we have a 3D lab here where we are able to reconstruct a three-dimensional representation of what a patient's tumor looks like. For example, a massive amyloblastoma case that requires a fibular free flap. It gives us the ability to print a model out, plan our cuts, and plan how big our fibular free flap is going to be. We also have other opportunities here, such as the T-bone lab, where there are a bunch of microscopes that we can use to practice our microvascular reconstruction. So not only do we get that opportunity to grow in the OR, we have quite a bit of opportunity to grow outside the OR.
I would say this fellowship has a very long tradition of training both women and men in head and neck surgery, which I think not all fellowships can say they've been doing that for such a long time. And that's wonderful for representation. I can think of many of the female leaders in head and neck surgery have had their fellowship here at University of Pittsburgh. It's so fun to go to the American Head and Neck Society meetings and see people who've trained at University of Pittsburgh doing wonderful things all over the world. Our fellows are leaders, our fellows are going on to head their division in so many programs. And it's almost like the Steelers, where you can always find a Steelers bar. You can always find someone from University of Pittsburgh leading the way in head and neck cancer in cities all over the world, actually, and we're really proud of that.
We really aspire to give our graduates from the fellowship all of the tools to not only start their independent careers, which all of our trainees have gone on to do as faculty over the past 30 years, but learn to be thought leaders in the field. So I guess what I'm saying is that this fellowship will prepare you not only to be an excellent and competent head and neck surgical oncologist, but will also position you to have a leadership position and be a thought leader in the field if that's where you desire your career to go.
We're not just training you for today. We're training you to have the tools to meet the challenges of head and neck cancer care tomorrow.